Jim is actually on a headset, and I don't know, Gloria, if you're hearing a lot of background noise, but I'm hearing a lot of static. So if you want, we could mute Jim right now, if you could do that, and then during the presentation, we wouldn't hear that, and then at the end, we can open it back up in case there's any questions.
That's fine.
Okay. Perfect. Well, again, good morning, everyone. I hope everyone's trying to stay warm. I know that's not easy these days. Again, thank you for allowing me to present today on employee health and wellness programs. You know, most healthcare and risk management professionals believe that health and wellness programs can reduce rising healthcare costs and improve the quality of life for workers. But do they really live up to all the hype? You be the judge. Perhaps some of the things you'll hear today will help you to decide. In this presentation, we'll lay out what most experts believe constitute a best practice employee health and wellness program. We'll discuss reasons why your organization should consider implementing one. We're going to look at both the pros and the cons. We'll talk about whether or not employee health and wellness programs actually produce a return on investment. We'll hear about organizations that have implemented successful programs. And finally, and perhaps most importantly, learn how your organization can develop its own program. So what does an employee health and wellness program look like? Experts tell us that, I think somebody put us on hold. Okay. Experts tell us that a best practice program should include every employee, address all major health issues, encompass not only the employee, but also the workplace, stress continuous follow-ups that offer support, and it should involve regular evaluation of results that provide opportunities to tweak, enhance, and improve the program. According to an advisory panel for the CDC, or the Centers for Disease Control, there are 7 criteria for a successful best practice employee health and wellness program. First, it should align with the already established core mission and goals of your organization. It has to fit within your culture. It must be present throughout the organization at all levels, from the top down and from the bottom up. It should also include the work environment, and there must be a written, well-communicated policy. Baseline information needs to be developed, and the program should target those healthcare issues in your specific workforce. Then experts recommend taking it a step further to incorporate the unique needs of your employees. And the goal of the program is to get as many employees engaged as possible. Program objectives should include better medical outcomes, reduction in costs, and meeting organizational goals. Once fully implemented, the program should continuously be evaluated to ensure that it meets or exceeds predetermined success metrics. Many organizations wonder if they should invest the financial and human resources needed to develop and implement an employee health and wellness program. Most have done the research and determined that yes, they in fact should. In fact, the majority of U.S. employers have implemented some form of a wellness program. And in studies done by the American Journal of Health Promotion, they found that wellness programs reduced sick leave by 27% and lowered workers' comp and disability claims by 32%. The University of Michigan Health Management Resource Center determined that when an organization invests in an employee wellness program, that they save about $350 per employee per year when those employees that are deemed low risk actually stay low risk. They also found that the organization saves about $153 per employee per year when health risks are reduced for those employees that are considered high risk. And of course, with any program, there are pluses and there are minuses. First, the pros. Employee wellness programs improve health. We know that. When employees participate in managing their own health, they take ownership. Employee wellness programs have shown that they increase employee morale, and in doing so, actually increase productivity. As discussed earlier, they lower employee absences, both for disability and work comp claims. Again, as we previously talked about, they also reduce costs, and they provide results that can be recognized not only by your own leadership, but by the media in publications for things like awards for excellence or even maybe employer of choice. While the vast majority of employee health program results are positive, employers need to know that there can also be some potential negative effects. There may be pushback from employees who feel that their employer is trying to force this on them. And rather than increase morale, it can actually temporarily hurt morale. Some employees may feel like their privacy is being invaded. They might even feel like they're being discriminated against for some condition that they have. If an organization offers too many options, at least at first, employees may feel a bit overwhelmed, so be careful with that. And some organizations do not feel that the costs are worth it. So are they? Is there a return on investment? Well, a study done by Harvard found wellness programs have a return on investment, or ROI, of 3.27 to 1 with regard to healthcare costs. So for every dollar spent on an employee wellness program, they found that an organization saved $3.27 in healthcare costs. Likewise, on absence costs, organizations saved $2.73 on every dollar invested. Another study found even better results, a $6 return on every $1 spent on employee wellness. An employer in Colorado determined that they had an ROI of $5.81. A company in San Diego evaluated their success by the number of employees participating in their Healthy Habits program. They found that at 6 months out and at 12 months out, 75% of participants were still maintaining their healthy habits. Healthy habits in that program included things like drinking a certain amount of water and taking a walk on their lunch break. Caterpillar, the world's largest manufacturer of construction equipment, decided to implement health risk assessments for their employees. A health risk assessment is a health questionnaire used to provide an evaluation of health risks and the quality of an individual's life. They capture information relating to things like age, sex, lifestyle, including exercise, smoking, diet, and alcohol use, and personal and family medical histories. They also capture data about weight, blood pressure, and cholesterol. They include questions about one's attitude and willingness to change behaviors in order to improve their own health. So Caterpillar offered to reduce an employee's monthly health insurance premium by $75 if they simply completed this health risk assessment. And 90% of their employees completed it. And then city employees in Houston, Texas are required to perform 3 health-related activities, are they're charged an extra $25 per month. As a result, in this case, again, 90% of them chose to participate. At Florida Blue, an insurance company, workers can earn up to $500 when they decrease their health risk factors. Since they began their program, employees that had 5 or more health risk factors decreased in half, and employees that had 2 or fewer health risk factors, which was considered a good indicator, actually went up from 41% to 59%. At Johnson & Johnson, employers get $500 off their annual premium for turning in a health profile, and then they can get an additional $250 when they modify their activities based on data from their file. As a result, they have measured a return on investment of $4 for every dollar that they invested. Health Advocate, the nation's leading health advocacy and assistance company, has developed 6 steps to creating a successful employee wellness program. First, establish what your goals are going to be. It might be to lower health care expenses, increase productivity, lower absenteeism, or use the program as a tool to recruit new employees or to possibly retain your current workforce. And remember, what works for one company might not work for yours. Success is based on customizing programs to your specific population's needs and interests. And it's also important to have a timeline that is neither too short or too long, because either can stall participation or create unnecessary stress. And determine how and when outcomes are going to be measured. Step 2 involves assessing needs. Asking employees about the types of programs they're interested in is key to success, to get their buy-in. Even if only 20% of your employee population is overweight, 80% of your employees might actually be interested in having a personal coach to help them exercise and eat better. Health risk assessments can be in print or electronic formats. They provide employees with an in-depth summary of their risk for disease as well as unhealthy habits. And this HRA, or Health Risk Assessment, also provides data that employers can use to determine the best programs for their workforce. Employees may be unaware that they have high blood pressure or an unhealthy weight. Biometric screenings like blood pressure monitoring, measurement of body fat, and other early disease indicators can help bring this awareness to them that otherwise they may not have. The third step in creating an employee health and wellness program is to develop a culture of wellness, and it starts at the top. Elicit senior management support. This support needs to be more than verbal. It's valuable for employees to see their leadership team involved, like attending health seminars with the employees. Create a healthier workplace by banning smoking on the property, putting bottled water and healthy snacks in vending machines, and serving healthy food choices in the cafeteria. Use social marketing to sell the program by encouraging such things as forming a company team to walk for the March of Dimes or for a cure for breast cancer, getting actively involved in the community and at the same time improving your health. When employers make participation easier, participation will likely go up. Consider offering on-site weight management meetings, outdoor walking paths, and online tools to access wellness coaching. Give employees options so they can choose what fits best for them. Include and encourage family participation. When the entire family, spouse, significant other, and children are included, participation goes up. Step 4, maximizing participation rests on a communications campaign that is far-reaching, that is ongoing, that is targeted to your specific workforce. Employee newsletters, meetings, posters, and other internal communications should include education on the importance of a healthy lifestyle. It's good to have a forum for sharing successes, which can be very powerful in motivating others. Communicate how simple it is to get started. For example, have sign-up sheets for a walkathon in the cafeteria or the lunchroom. Find new, interesting ways to remind employees about the benefits of exercise, weight management, or smoking cessation. Stress the value of participating, such as how the program can improve the quality of their life. Be sure, as I said before, to include family members, both in announcements and for ongoing communication. And encourage participation by emphasizing the need to improve health and prevent disease. Step 5 involves setting up incentives to encourage participation. Studies have shown that rewards offered at regular intervals get employees to participate, rather than only offering a reward at the end. It's also effective to help employees associate their participation with an end result. And you can do this by tying their specific activities to those rewards. And the final step, celebrating success. This can be done in several ways. If you offer a weight management program, highlight the fact that the group lost X pounds during the last quarter. Or if there is a walking group, have them track their miles and celebrate when they walk a certain amount of miles. Tally and announce company-wide totals with regard to participation and results. And lastly, hold group celebrations to recognize this participation and those results. So, if your organization is considering an employee health and wellness program, be sure to put together a well-thought-out plan. Get buy-in from senior management. Make sure the program elements align with your employee population. Communicate, communicate, communicate. Evaluate how you're doing, and don't forget to celebrate your successes. So now, I would be happy to answer any questions or hear any comments that you might have about what you've heard. Gloria, do you have any additional comments?
First, I wanted to say thank you again for presenting this information to us today. The information that's presented is very helpful, very timely, at a time when we're all looking at ways that we can manage our healthcare costs. And I think a lot of things that you shared are very critical. One of the things that I want to give emphasis to is communication with staff. One of the things that I've learned in working with another member is by getting their employees involved and communicating with them, they've had a really, really fantastic turnaround in reducing the number of incidents that they've had at their location, also in reducing their costs. So they're pretty excited at this time. I want to open the floor to those who may have questions. Before we start the questioning portion, I am going to turn off the recording. Any questions out there? Anyone like to ask Daryl any specific questions about employer health and wellness programs? Would anyone like to make any comments? You are too quiet. Is that cold out there? Okay. Well, then I will not hold you any longer than what we need to do. I sincerely very much appreciate the time that you've taken out to listen to this webinar for this time with us. If you do have any questions later, or if you are wanting any type of support information, do not hesitate to call me or email me. I'd be happy to get that information to you. Again, I want to say thank you for your time and joining us on this webinar today. Daryl, thank you for your in presenting this information on the webinar. You all be safe out there and stay warm, and I'll see you soon.
Thanks, everybody. Have a great day.
Thank you.
Thank you. Bye-bye.
Bye-bye.
Daryl?
Yes.
Okay. I'm gonna call you back. It's gonna disconnect me from the meeting.
Okay.
Oh, are you still okay? It did not. I thought it would for sure. Okay. So thank you. I appreciate very much your information presented.
Well, I appreciate the opportunity, and you know, if we want to look into next year, if there's other opportunities, if you want to delve into this deeper or some other topic, I'm always available to help in any way that I can.
What other topics do you present on?
You know, things like patient handling, slip, trips, and falls, needle sticks, bloodborne pathogens,